In the United States, about 60,650 new cases of leukemia were diagnosed in 2022, and roughly 24,000 people died of the disease, according to the American Cancer Society. Around the world, there are about 475,000 new cases of leukemia diagnosed each year, with over 311,000 deaths. White blood cells are key players in your body's defense system, springing into action when germs and other invaders in the bloodstream threaten to make you sick. White blood cells, which are also known as leukocytes, are made in bone marrow, the spongy tissue inside bones. The form of cancer called leukemia occurs when the body begins rapidly producing abnormal leukocytes, which can't fight germs. What's more, these abnormal white cells interfere with production of red blood cells and platelets, which can damage organs and tissues. Medical historians believe that the first report of a disease resembling leukemia occurred in 1811, when a British doctor named Peter Cullen discovered that a male patient with abdominal pain and a fever had milky-looking blood due to an accumulation of white blood cells. Soon, other doctors began to describe patients with similar conditions. In 1847, the famed German doctor Rudolf Virchow gave the disease a name, Leukämie, which came to be called leukemia in English. Since then, scientists have identified 4 major types of this blood cancer: acute lymphocytic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, and chronic myeloid leukemia. These diseases differ in important ways, such as how fast the cancer progresses and what blood cells are affected. Doctors are still trying to understand what causes leukemia, but the disease begins when the DNA of a single leukocyte develops a change or mutation that causes it to behave erratically. The cell divides and makes a copy of itself, an action that is repeated over and over. Eventually, these abnormal cells crowd out healthy blood cells and cause leukemia. Leukemia is the second most common form of blood cancer, after lymphoma. In the United States, about 60,650 new cases of leukemia were diagnosed in 2022, and roughly 24,000 people died of the disease, according to the American Cancer Society. Around the world, there are about 475,000 new cases of leukemia diagnosed each year, with over 311,000 deaths. Leukemia can occur at any stage of life. However, some forms are more common in young people, while others occur more frequently in older adults. Overall, leukemia is slightly more common in men, though some forms of this cancer can be more aggressive in women. Doctors have identified a number of risk factors for leukemia. Some are common risk factors for other types of cancer, such as smoking and family history. Treatment for other cancers with chemotherapy or radiation may make you more vulnerable to leukemia too. Other risk factors are less common. For example, chronic exposure to the chemical benzene, such as in the workplace, increases the risk for leukemia and some other blood cancers. People with Down syndrome and certain other rare genetic syndromes also have an increased risk. The same is true of people who develop bone marrow disorders known as myelodysplastic syndromes. There are a few specific steps that can lower the risk for leukemia, such as quitting smoking and avoiding benzene and other industrial chemicals. If you're overweight, shedding some pounds may help. Otherwise, eating a healthy diet and exercising regularly are the best advice. Leukemia can cause a wide range of symptoms. A patient may lack energy and develop flu-like symptoms such as fever and chills. Because white blood cells aren't working properly, the patient may have frequent infections. Swelling in the neck, underarm, groin, or stomach may occur, among other symptoms. The treatment a doctor recommends for leukemia will depend on several factors, including what type it is and how much the cancer has spread. Chemotherapy and radiation are common treatments for leukemia, and some patients are candidates for a bone marrow transplant, in which the patient has his or her diseased blood cells replaced with an infusion of healthy blood cells. However, many leukemia patients today can benefit from newer treatments. That includes drugs called targeted therapies, which find and attack specific molecules that cause cancer to grow and spread. There are also new forms of immunotherapy available that make the body's immune system better able to identify and destroy cancer cells. But in addition to treatments your doctor can offer, patients have another option. Enrolling in a clinical trial can give you access to new therapies months and even years before they're available to other patients. These advanced treatments can be life-changing, and some may even offer a cure. There are currently close to 1,400 clinical trials of leukemia treatments underway around the world. Give yourself the gift of hope by learning about all of your leukemia treatment options.